This is Dr. Munyon with Exotic Vet Care and Ruth Bader Hensberg, and together we're going to show you how to tube feed a chicken. We have to do this sometimes when chickens are debilitated or mentally inappropriate and unable to eat on their own. And we're trying to fill up this area right down here, which is the crop. It's a kind of storage area before the digestive parts of the gastrointestinal tract. So first off, we have our chicken ready, we have a towel, we're definitely going to need it. And then we have our food all mixed up and our tube. So we have everything ready. With a really sick chicken, you may not have to restrain them too much. Ruthie here is pretty healthy and is not going to like this. So we're just going to gently bundle her up, making sure not to put too much pressure here because this is where the food's going and we don't want to squish it and force the food back out. Okay, we're gonna go ahead, strain our chicken, and I have her wrapped up so her wings are contained, but her crop is still going to be right here. And there is some relevant anatomy, so we're going to do a quick little cutaway to that. Okay, we're going to go over some relevant anatomy for when you are either giving oral medications or tube feeding a chicken or similar bird. So in this image here, we have the upper beak and the lower beak, and we are looking straight in with the beak wide open. And we are aiming for this area back here, which is where the esophagus is, and where we want our tube, pill, or liquid medication to go. Down here, we have our tongue, and at the base of the tongue is going to be a little opening that will flare open and close with the breathing, and what that is the glottis, which leads to the trachea. We don't want medication to go there. That's not where we're aiming for. Then up here, in the top of their mouth, is a little ragged looking opening called the choanal slit, and that leads to their nasal passages. Again, not where we want our medication to go. So we're aiming kind of along the side all the way to the back of the mouth to this big opening back here, which leads down to our esophagus. All right, now that we know where we're going to do the tube feeding. A few things to know first. When you're tube feeding, you want to know 2 out of 3 things to make sure that you are going in the right spot. So first off, one thing you can do is make sure that when you put the tube in, don't see it going into that glottis or airway opening that we pointed out in the little image. The next is you're going to want to be able to feel 2 tubes. So when you feel their neck, you can feel their little trachea there. It's good to take a feel of this beforehand. And trachea feels like a ribbed straw going up and down the neck. And when you have this tube in, it's going to be down the esophagus. So you will feel 2 separate tubes rather than just the one. And then the third final criteria is you may be able to feel the end of this tube down in this crop here. So 2 out of those 3 things means that you're good to give the feeding. And then while you're feeding, you're going to want to watch the back of their throat to make sure that there isn't any food coming up. If you see food coming up, you pull the tube out right away, set your chicken down, and let them figure it out. Don't try to swab or anything, just let them figure it out themselves. So we're going to go ahead and do the tube feeding on little Ruthie here. We got our chicken, got her head, got my tube ready. So I'm going to go ahead and, I know we hate it, go in through the side. And I know you can't see it right now, but I can see that I did not go in the glottis. I can feel it going down past my fingers. So I got my 2 tubes. Yep, there's 1, there's 2. And then this one, I probably won't be able to feel it down in her crop. So got my tube in place. She moved a little, so just gonna push it in a little bit more. And then I go ahead and push the food in while keeping an eye on the back of her throat. And mine's having some trouble pushing, but there we go. Push the food in. And then once the food is all in and you're all done, you're gonna kind of curl up and pinch the tube so it's not gonna drop. I know, sweetie. So it's not going to drop any of the food or medication into her airway. So it's pinched off and we pull it straight out and she's all done. And then we leave her alone to figure herself out. And that's how you do the tube feeding.